I understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted for access by facility and students at the Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the facility and staff, as well as the student, which happens to be my daughter, are not considered liable.
Okay, thank you.
Oh, you're quite welcome.
Okay, today we're presented with a 60-year-old male, hypertension and proximal AFib. His vital signs read 165/90. Heart rate is in the 100s to 116. Respirations are 16. Temperature is 98.1. So he's presented today with evaluation of his atrial fib, chest palpitations, and no dizziness, you said, right?
Correct. That is correct.
When did this start?
That is hard to say. I believe that I've had this for quite some time, and it was just diagnosed within the last few years when I was at the doctor's office for a checkup. I was in AFib. I never knew what the sensation was, and it had been going on for years. The doctor immediately put me on blood thinners and Sotalol, I believe.
Do you ever experience dizziness or lightheadedness?
Never. I never get any shortness of breath, never chest pain, never any of that stuff. Classic signs. I do not.
How about your diet? Do you drink a lot of fluids, a lot of water?
I drink a lot of fluids. I don't drink a whole lot of Pepsi and Coke. I do drink alcoholic beverages, but not that much. Maybe a few times a week, and that's about it.
Have you any recent weight changes? Any swelling in your lower extremities?
No swelling in my extremities. Weight change, I go from 171, I'm sitting right now at 173 pounds.
Just wanted you to know sometimes AFib can be brought on with hydration, some precipitating factors, dehydration, infection if you get sick. That can also increase your chances of becoming into AFib. Have you been sick lately?
No. Actually, yes. I had a sore throat about 3-4 weeks ago. A little bit of cold symptoms, but then it went away pretty quickly.
What kind of job do you do?
I work at Jewish Hospital ordering medical supplies.
Do you sometimes stay up late at night?
I stay up late every night because I work the evening shift at the hospital. I get off at 8:30 and I stay up until about 12.
Do you ever feel that sleep, like you don't get enough sleep?
Yes.
Do you think sometimes that could kick you into AFib?
No.
No? Do you live a pretty active lifestyle?
I'm very busy at work. I take a lot of steps because I am all over that hospital.
How about snoring? Have you ever been told that you snore?
Yes, your mom has told me that I do snore.
Some doctors believe that AFib can be contributed with snoring, so I would recommend the doctor today get you to have a sleep study done, maybe, and see if that can help, and you may need some kind of breathing apparatus at nighttime to help you breathe better.
Okay.
Let's see. So I see you've had an ablation.
Yes, I've had 3.
How long after that procedure did you feel yourself going back into AFib again?
The first one was November 2nd, 2012, and it did not work. I had another ablation on November 28th, and that seemed to have worked for a little while at least. And then I had another ablation on October 27th of last year. And after that third ablation, he changed my meds, and everything seems to be fine now. Every once in a while, periodically, I'll go into AFib, but it's very seldom.
I see you're on amiodarone now.
Yes.
Have you had a pulmonary function test in the last year?
Yes, I have. I had one about maybe a month or so ago.
And did they check your blood and your thyroid levels?
That was already done, and I've got the results over at the house. And yes, it was done, but I never got the results for the pulmonary function test.
Oh, not yet.
No.
Because sometimes amiodarone can become toxic to the lungs, so every year the doctors like to prescribe or make sure they get their lungs checked just in case. It's not attacking their lungs.
I talked to one of the respiratory people, and she told me that the pulmonary function test was normal, except for a little bit of COPD, which could be the result of my previous life as a firefighter.
Okay. Well, thank you very much. I will relay this information to the doctor. He may want to change your meds or anything like that.
Okay.
But continue to take your Eliquis. Are you on Eliquis now?
Yes, twice a day.
That's good. You don't have to get your blood checked for that. A lot of people like that. Okay.
Yeah, the Coumadin, I had to get periodic blood tests.
And you're not having any problems with the Eliquis? You
None.
take 5 milligrams twice a day?
I don't know if it's 5. I'd have to look. I just refilled today. But, yes, I take it religiously.
Okay. All right. Thank you.
You're welcome.